All right. Good morning.
Morning.
Still morning.
Tuesday morning. Tooth Talk Tuesday morning. It's October. It's been a while since we've visited with you.
I know. As we look out the window, we see the leaves changing and looks beautiful
Leaves changing,
outside.
but it's 80-something degrees out there, so it's a nice day. I wish I was out there, but hey, we're here.
Maybe we do it afterwards.
And maybe, it is Tuesday, which means we start extremely early and also get off in the middle of the afternoon. So we have a little bit of an afternoon, but now it gets dark so soon, relatively soon compared to what we're used to. It seems like the afternoon is short that way.
I know.
But here we are.
Yes. So today we're going to talk about recession.
And the coming recession. No, not the economic recession. We're talking about the recession inside your mouth.
So yes, and we're talking about some causes and what we can do hopefully to prevent them. And then if it does happen, what can we do? So,
Right. Yeah. What can we do? Well, let's first talk about how does it happen? What happens? Sometimes, and people will say, long in the tooth. That's the whole thing. And that's because your teeth look longer. They're not actually longer. They look longer because the gum tissue has receded away. Couple of causes. First cause is probably gum disease. Periodontal disease, where the tissue that holds your teeth, the bone and gum tissue that holds your teeth in place, deteriorates. It's a bacterial, it's like an infection, basically, a chronic long-term infection, and your body's reaction to that infection that deteriorates the gum tissue and the bone. Go ahead.
No, I say, so with that, is that something that happens and you can't control it or you can't stop it?
Well, you can stop it usually because it requires treatment. But it requires treatment. You just can't let it go and say, "Oh, I think I discovered this, so now it's going to stop." No, you've got to get something done about it, and we can do that. Sometimes we do have to refer to a periodontist, a specialist in gum diseases. Sometimes requires surgical intervention and bone contouring, bone grafting, gum tissue grafting, even from another part of your mouth that repositions the gum tissue to cover the root that's been exposed from the disease. But there are some other causes too.
Right, I was going to ask you, how about that?
Well, what else happens? Some of it is iatrogenic.
Ooh, iatrogenic.
Which means we did it to ourselves. And that means too hard a brush, too firm a brush, too a wrong technique, bad technique, too long a time in brushing, and certainly too firm a brush is probably the worst cause. But so what you don't want to do is saw away at your teeth. You think, I'm brushing them, I'm cleaning them like a white wall on a tire. For those of you who may have that certain age, it's like you're scrubbing it away, and that's going to make it really pretty. Well, you're wearing it away. You're wearing away the gum tissue, and then once the root gets exposed, which is a little yellower than the normal enamel that you see, it's softer. And it exposed the next layer of the tooth, the cementum, the dentin, which is the yellow part, and it's softer. And that you can actually physically remove some of that tissue from the tooth itself. So you end up with a notch, a little notch, literally like a wedge into the tooth structure, and that can cause some sensitivity. Can also cause decay because things will get stuck in that groove and and when it gets big enough, your toothbrush bristle can't fit all the way into that groove. Mm-hmm. And what you end up with is stuff stuck in there. So then it might turn into an actual cavity, not just exposed root surface, but a cavity. And then, of course, requires intervention as well. What else? Well, there's some other good causes.
How about if I'm stressed or anything?
Stress.
How could stress cause my gums to recede?
Well, it's a strange phenomenon, but clenching, tight clenching, grinding teeth. The stress on the tooth structure itself can cause some erosion or deterioration, and the theory is. Go ahead.
Oh, well, I was going to say, I always give this analogy, say, top tooth and bottom tooth. If you're grinding like this, you're just causing, and you probably can't see, but imagine just being
the stress
is concentrating in that area. So the gum tissue does this, and you get that notching that Dr. Huetter was
I
mentioning.
like that. I like that sleeve thing. I think that was a great idea. Um,
Thank you.
Yeah.
We'll trademark that
Yes.
later.
Abfraction is
Yes.
the theory that can cause some breakdown of the thinnest part of the enamel where it adjoins the root of the tooth, and so that can cause some of the root exposure, recession. And again, we're right back where we were. Now, some people can have massive amounts of root exposure and have zero sensitivity. They don't even know it's happening, except by how it looks, maybe. And then other people can have the tiniest, like a millimeter of exposure, and jump out of the chair at the exposure to cold air or cold water. So they are a wide variation in presentation. What you feel may not be anything like what your spouse or someone in your family or your next door neighbor or your best friend feels. I mean, it's a totally different experience for every single person, really, and that's what makes it a little bit of a challenge, and it also changes how we might approach it too.
Correct.
You know, if someone who can have a lot of exposure of the root but no sensitivity, and as long as we identify the cause and stop it from getting worse, we may do nothing. But then again, somebody has a very small exposure but is jumping at every exposure to cold or air, then we may fill that. We may actually put a restoration there. Sometimes it's a filling. Sometimes we try to treat it with certain kinds of chemicals that will react with the tooth to make it less sensitive. But sometimes it just requires us to put a tooth-colored filling bonded to the tooth, which acts as an insulator from the assault of the cold or air, cold liquids, and protects the tooth in that way. So, like I said, it's completely different for everybody, and it might even be this on the same person on a different tooth.
Right.
One time, a tooth could have a big exposure of the root, and the gum tissue is receded, and doesn't require anything. But then a tooth somewhere else in their mouth has that small root exposure, and boom, they're jumping every time. So that's what we do. It's part of what we do is, of course, identify it, try to identify the cause, try to prevent it from getting worse, and of course treat any symptoms that might be occurring.
Wow, so that's a lot of information.
A lot of information there, and I would say it applies to almost every adult, because everyone we see has some form of that recession. I mean, if you're over 40, say, you're going to have some form of recession. It would be rare to find someone who has none. You know, where you can't find that little notch at the end of the enamel, or some visible root exposure. Like I said, it's more yellow of your tooth than the normal enamel that's exposed.
So life happens, I guess.
Life happens. So I guess the long and tooth, analogy for old people is somewhat true, because as you get older, there are going to be more likelihood of almost everyone having some kind of root exposure. Now, that's counteracted often the length of the tooth, because you've got the root, the root exposed, so it makes the tooth look longer, but on the other end of the tooth, you're grinding away at it. So you're shortening that end of the tooth as you're exposing the bottom end of the tooth. So, it's a little bit of a dichotomy there. So that's what we see. And so you should be aware of that too. I mean, sometimes you may have sensitivity and not know why you have it, like to cold things, or you see all these yellow areas, or sometimes as over time, they can turn dark brown too, because that is more absorbent part of the tooth, not the enamel, but that yellow part of the root. And so it can actually discolor. Sometimes it's decay, sometimes it's just accepting stain, basically, that you're exposing it to.
So I guess the bottom line is that if you have any concerns, and also our hygienists do a really good job. The
hygienists are excellent. They actually, most of the time, they are notifying us as we come in for the exam what they've already seen, and so we're on the alert for that as well. But they tell us too.
So yes, I know lots of good information today. And
I think so.
It's
yes.
good to be back.
It's good to be
know?
back.
So
yeah.
next time we see you, will be closer to
Oh boy.
All Hallows Eve. Right?
Yes, probably closer to Halloween, and of course we'll have the usual admonitions about sugar, sticky things, and so forth. Actually, I had a patient today, just today, broke his tooth. Peanut brittle. Come on, come on.
It is good though. But
it's good, but bad for you. I can't think of a good thing for you that it is really. I mean, it's got nuts in it. Okay, people like nuts. Eat the nuts without the brittle part.
Soak them. Soak them in something.
That's a lot of sugar, and it's hard. It's unpredictably hard. That's the problem there. And sometimes the nut itself is unpredictably hard too. But anyway, that's a whole different tooth talk. We're not talking about that. Okay, so no recession. That's our goal.
Right.
In any way, in every way, no recession.
Read my lips. No recession. For those of you who are old enough to know.
That's a long. That goes
I
back
know
a
you
long
youngins
way.
don't know that.
Decades into a whole different century. But that's where we're at. And thanks for joining us.
Yes, we appreciate you. And if you have any questions, call us 330-452-2255. But thank you, Dr. Huetter. And
thank you.
Awesome day, and make it a great day. Be happy, be safe, be healthy, be happy, be safe, be healthy.
That's it. That's a good song.
I know.
Next time he'll perform for us.
I know. Someone brings some.
He'll do that. That's a rap song.
There we go. Oh, I can probably make a country too.
Okay.
A little
Let's
twang.
do it.
All right.
We can do that. Okay.
Have a great day.